Emer, let me tell you. But seriously, folks, Dr. Emer is a board-certified and fellowship-trained general, cosmetic and procedural dermatologist, interest in specialty beginning with body contouring, liposuction, fat harvesting and transfer, and later including facial fillers, peels, laser and light treatment, and plastic surgery. He's an author, well-sought medical expert, and today, right now, he's going to talk about how he, in second person, achieves superior skin rejuvenation results and profitability with the SaltFacial Skin Renewal System. Please give another warm welcome to Dr. Emer.
Thank you, everybody. The first thing I would like you to do is pull out your cameras, take a picture, tag me, and post it online. The second thing I want you to do is go to your Snapchat and go to my filter and take a picture of yourself and post it online. Because if you are not doing social media, you're screwed in this industry. I'm sorry, but it's true. And one of the reasons SaltFacial has been extremely successful in our business, in our practice, is not only the superior results that we get, but we're able to show patients that before they even come in. So obviously they're coming in asking for this specific device. And right now we have about 63 different devices in the practice. This is one of them. And the reason we really like it is we see great results. But you really don't want to advertise or market a specific device. You want to market and advertise your philosophy. So one of the things I'm going to talk about today is how I use this in my practice to build up all the other treatments that would complement this together, because typically this is packaged in with everything else that I do to give patients an overall big improvement. The great thing about this device is it's a multiple modality machine, so not only are you exfoliating, you're infusing, and you're using LED therapy to restore the skin, decreases inflammation, and it's great for every skin type. How many people have patients that come in with darker skin, post-inflammatory hyperpigmentation, rosacea, mixed ethnicities? They're nervous about getting treatments because they know that peels and lasers and even aggressive microneedling can damage their skin and cause hyperpigmentation. With this, because it's pressurized, there's LED therapy, it's never going to do that. So it actually can reverse a lot of those symptoms. So the SaltFacial system is really unique because it uses a pressurized pressurized system that infuses salt into the surface of the skin, and instead of using trauma or any metals to break apart the dead skin on the surface, it's actually using the pressure of the salt to do so. So you get a lot of renewal relatively quickly. Now the early stages of the device had a little bit less of a pressure. Now we've been able to increase that pressure to the point where you can almost do a deep or medium chemical peel before you even laser somebody. So you can do this now in areas of the elbows, the knees, the feet. In my opinion, every medical spa that does anything with feet should be doing SaltFacial before they treat their patients, and then doing a paraffin treatment and a chemical peel afterwards. If I didn't just give you one of the best return on investments in your entire business, in your entire life, I just gave that to you, because in our practice, it's an adjunct to every procedure. You will not be getting a laser in my practice if you have not pre-treated your skin. I will not allow it. You have to either do some sort of exfoliation treatment, whether it includes SaltFacial or a peel, and you have to be doing that, preparing yourself, because you're going to get a much better result. The other thing too is cleaning the skin. Salt is a natural cleansing agent. So when you treat the skin before you do fillers or before you do any other procedure, you're less likely to get an infection, which is one of those things that you tell patients that they're going to really think that you're doing one of the best things for them, which is the truth. You're really trying to make sure they don't get any issues. But you can do this as a standalone therapy. So what you should do is have a menu where the patients can come in every single month for a package and get this treatment done, and then any of the additional things that you want to do for them is an upsell for them. So they want to get a laser, a microneedle, a PRP treatment on top of that, add that in as an added value. So how does it work? Like I told you guys, in the first treatment, we're restoring the skin by removing the dead surface cells, pushing salt into the surfaces, similar to the concept of what a microderm does, but in a different way. And we're removing the keratinized cells, and we're influencing salt on the surface. As you know, salt will hold water, which is why when you eat too much, like I've done this past couple days, you don't see your six packs anymore, because it's holding water and you're absorbing fat. But then the second step is to push the salt deeper into the skin so that whatever you then put on the skin at the same time is going to penetrate even deeper. So if someone had melasma, you put that hydroquinone on. If someone has, or vitamin C or kojic acid. If someone has rosacea and you want to do things that are anti-inflammatory, you put that on there, like silver, for example, or niacinamide. And the last step is rejuvenation. So you're going to use the LED therapy to decrease inflammation. Now, there's different wavelengths on this light here and numerous LEDs that are in there that not only treat acne and photorejuvenation, but also can decrease inflammation, and you can do a mix of each of them to get even more improvement.
So this kind of SaltFacial.
Can you turn the volume up?
My skin is literally glowing.
You definitely feel the salt on your face, and it's like when it's shooting, you can kind of smell it and feel it and taste it a little bit in the
Patients feel
air,
like they're on a vacation at the beach. Because salt is just flying all over the place, and it really shouldn't be, but it's a little bit. And you taste it, and you feel it, so patients get a sense that they're like at the beach or at the pool. So it actually gives them a calming sensation, and you'll see what that patient has to say later. We need the volume up higher.
Sea salts as our physical form of exfoliation. So this is our exfoliation step, and we're treating at a lower level because this is just a monthly maintenance facial we're doing here, just to keep the cells turning over and the skin bright. But we can treat at a higher setting, and that will treat things like stretch marks, scars, deeper wrinkles, fine lines. So this is really good for all types of textural issues with the skin. And the thing I love most about this is that we can treat any skin color, any skin condition. This benefits everyone. And it leaves these tracks of salt here on the skin. And after, I'm going to apply a hydrating serum. And the salt carries the hydration into the deeper levels of tissue. So it really truly hydrates at a cellular level. And people ask if this is similar to microdermabrasion. Really, the only reason it's similar is because both microdermabrasion and SaltFacial are physical forms of exfoliation. But this definitely one-ups traditional microdermabrasion because we're using a natural element, sea salt, as our exfoliant. It is naturally antibacterial and antimicrobial, which means it'll kill acne bacteria. This is also much more gentle. The machine uses no suction. It's a closed loop of pressure. So the skin is the final part of that loop of pressure, and that's how we get the salt to spray out. And you can see it pulled up a lot of dead skin right here, which is great.
And again,
so next
if you
I'm applying
go
a
aggressive
hydrating
enough,
serum.
you
This
can
is
get
going
a
to
very
carry
deep
that salt into the deeper
exfoliation.
levels of tissue, making his skin nice and hydrated.
This is a light
the second
treatment.
step is ultrasound cavitation. So the salt stayed on the skin as we applied the hydrating gel, which will carry the hydration to the deeper layers. So we're truly hydrating the skin at a cellular level, which makes the skin look brighter, less fine lines and wrinkles, makes everybody look younger and feel better. And this part is everyone's favorite because it's just like getting a massage. And the third step is LED light therapy. And this reduces inflammation, it activates collagen in the skin, it helps with acne, and overall visible signs of aging. Our final step is the LED light therapy. And we are going to do collagen restoration just to give the skin a boost in collagen production. So this is just like photosynthesis for the skin. So it activates a collagen response, aids in healing, helps support the healthy structure of the tissues, it reduces inflammation, and there's no downtime with this treatment, so you can leave the office and head straight out. Usually people say their skin just looks cleaner and they leave with a nice glow, which is nice, so you don't have to prepare for any downtime.
Look at the pores. All clean. Now, is this supposed to be a dramatic result? It's not. This is something that people are coming into you to be doing a couple times a month at least, or if they're doing more treatments, they're coming in more often. But this is a newer step up from what we've done before in the past to really rejuvenate the skin. And then, obviously, you could do combination therapies. With that ultrasonic cavitation, there's a lot of things you can do, not with just nutrients. You could do chemical peels. There's other things you could do to actually penetrate the skin a lot more deeply because the cells are more actively uptaking topical products at that time. But again, there's no vacuum here and it's unique.
Removing oil.
So in general, we're removing oil and debris, we're lifting and opening pores, you're going to help pigmentation. If you do this in combination with peels and lightening creams, you can really improve melasma very significantly. The other thing is that it balances the alkaline levels of the skin. So if those patients that have those recurrent outbreaks of acne, that's not really acne, but they're MRSA or staph carriers, we have found a significant decrease in those patients. It's like treating them, it's like treating patients with bleach baths, because it's basically killing, it's anti-inflammatory, and it's killing a lot of surface cells. Also gives that immediate glow and tightness because you're exfoliating, you're causing the cells to boost collagen. And you can see some of the pretty good improvements. And here's another example of a little bit more of an aggressive therapy. Now, we did for this patient was pre-treated, then did IPL, then did a fractional radiofrequency, then did AquaGold, then sent him on his way. So that treatment can give a huge influence in collagen production because we're getting significant exfoliation here. But you can see, look at the pull on the skin. This is a little bit more aggressive, although you don't see bleeding, you don't see redness.
You can see the little track marks of salt.
But you can see the tracks are a little longer, it's a little bit more aggressive. So what does that mean? And I'll show you guys in a second. The reason I put these patients here is they're darker skin types. The one on the right being Middle Eastern, the one on the left having a dark ethnicity. And you can see the lightening of the skin with just that treatment alone. Now the other patients, our patients typically undergo lightening peels, clear and brilliance, other lasers at the same time to get improvements. And what makes or breaks this treatment is the speed and the pressure. Because you can look like, I'll show you in 1 second.
Before you get any of your tests,
you can take a look at the mild form of the treatment on the left and more aggressive form on the right. Because if you go at a stronger level, you go a little bit slower, a little bit more aggressive, you get that much stronger exfoliation, giving you that light, that redness that's there, because we're getting to the deeper levels of the skin before we decide to do peels or lasers. And this is what happens when you do that beforehand and then put a strong chemical peel on. You get a really good improvement in peeling. And you can see how much more it penetrated. The other thing here is this is just a before and after a filler, but the patient was also treated, oops, 1 second, with the SaltFacial right before, and you could see a lightening of her skin, okay? A brightening effect with just the LED, and basically this was done, I think the next day, no bruise, because of the LED therapy. So step 2 is the replenishing, and that's what I talked about, the increase in oxygen levels, the stimulation of the cells to uptake better. You're gonna penetrate topical products in a lot more, and we're doing a lot of studies right now, even using cavitation with Botox to get some improvement there for rosacea. And again, that second step is really important because the ultrasound is driving those antioxidants and peptides into the skin. And everybody now thinks stem cells and growth factors are hot, but they don't even know what they do. They just think they're hot, right? Even patients, they hear stem cell, they think it's the best thing in the world. So if there was a way to actually show that more penetration of those products help the cells, this will boost what results we're getting. And what's great also about this is the 4 wavelengths that you could see over here, and you can see the blue light, a little bit more superficial, which is why we use it a lot for acne, amber, near infrared going much deeper for collagen production, and red light for inflammation.
So the light at the end.
So here's that patient saying,
you rest for like 20 minutes, a warm feeling on your face, and you kind of just drift to sleep. And you wake up, you get it off, you adjust your eyes, and you're just like reborn.
So he felt reborn after this treatment. That's how amazing these patients feel. And this guy, just so you know who this patient is, we ran into this guy at a restaurant. He followed our Instagram. I said, you need to come in. And he's never done one thing for his skin ever. He's a golfer. I was like, you have to get a facial. So we're going to do this treatment. Now he tells everybody at the golf club to come get that treatment after they do golfing because they get sun damage. So you can see some significant improvements. This is his immediate before and after on Vizia. Take a look at the pores. Take a look at the lightening. That superficial sun damage is exfoliated. There's decrease in redness because the inflammation's gone down. And pigmentation has, gone down. And obviously this is just a simple type of facial, and we're getting improvement. So patients notice that they're glowing after treatment, they want to do another treatment, and they want to do something else on top of it too. If you go stronger, you can start to treat other things like stretch marks. Really good, in my opinion, while patients are on Accutane. So if you're a dermatologist and you prescribe a lot of isotretinoin, this is an amazing treatment for that, and they should be on that monthly. The other thing we do is a unique treatment that I was on the doctor show for, which is combining the SaltFacial. Remember I was telling you, you've got to combine these treatments to get even better outcomes. Well, we combine it with a proprietary mask that pushes 8 ingredients that brighten the skin with carbon dioxide. So if you take a look here, in this treatment, we not only do the SaltFacial, which includes the exfoliation, the infusion, and the LED, but what we're doing is, and I'll show you in a second, is after the salt portion, we then put on a proprietary ingredient that has 8 different ingredients to lighten the skin, which is what I mean when I'm talking about skincare at this point. You've exfoliated the skin, put on a peel, do a microneedling, do a laser, put on your proprietary product, whatever you want to do. But this patient was darker skin type and wanted to get some improvement, so I'll show you the mask.
The salt has hydrating properties, so it allows the skin to absorb anything you place onto it afterwards. So the second step in our specialized facial is using a sizzle mask. This is a proprietary combination of different lightening agents, vitamins, antioxidants, and exfoliators that work together to hydrate the skin and make it look bright instantly. So you do your salt exfoliation, and then we apply the sizzle cream onto the skin with a mask that literally bubbles, and you can hear it sizzle when it's touching the skin. What does this mean? It allows the skin to exfoliate while also pushing the treatment into the skin. So you're getting a much more medical grade facial, a combination of some of the best ingredients.
So that carbon dioxide causes more exfoliation. You can see here a brightening effect instantly. This was right after her treatment. You can see here, look right here. That, where is it? That, better. This, much better. So instantly, already improved. Look here, here, here. Significant improvement, one treatment. That is something that's, pretty significant. Same thing, one treatment. A treatment. Look at the redness reduction, much better. Look at the acne improvement. Look at the rosacea / sun damage. This is zoomed in of a patient that sent me some selfies, but you can see the improvement. Take a look at the pores. Watch the pores, all cleaned out. So overall, if you have an established busy practice or you're looking to just add something new, this is a great treatment that can complement a lot of the things you do, in my opinion, be packaged in or as an add-on for other treatments, because it's going to increase the amount of lasers, microneedling, and other things that you do. I'll skip that a second. The other great thing is very low consumables. All the companies want to constantly be making money off of you, so they make these consumable products that keep you, tied to golden handcuffs, basically. With this, you're getting a device that doesn't have much consumable except for a very small amount of sea salt, which eventually those salts are going to be custom made. They're going to be different types of salts, different grains of salt to be able to do certain things. So you have to look towards the future of what the device can be. We started at the beginning, but what we're creating is going to be something completely new. What if we had a salt bed? There's a lot of things that you can do as the future goes on. So instantaneous results, which I showed you, they sell themselves because the patients think they look great. 3 modalities in one, which we really love. It's multifunctional.
I'm the esthetician
and this is our esthetician Candace, who will be talking about SaltFacial this week and doing some live demos. So here's her reason that she likes using this.
It's my favorite resurfacing treatment because we can treat any skin tone, any skin condition with minimal downtime and less sensitivity than normal microdermabrasion machines. The reason I like the SaltFacial so much is because it uses medical grade sea salt and it's microfine, so we get less irritation to the skin with all the healing benefits of sea salt. The SaltFacial can be paired with several other treatments, so we truly get more therapeutic outcomes. We prep the skin with SaltFacial to get rid of all of the surface debris and keratinized skin. That way we can treat you at a deeper level with a peel or a laser afterwards. I've been an esthetician for about 12 years, so you can imagine all of the microdermabrasion machines that I've seen come and go on the market. And this is truly a one-of-a-kind device. It uses pressurized sea salt instead of vacuum suction, so we're not compromising skin that suffers from rosacea fascia or maybe broken capillaries, there's no risk to skin that is more sensitized. So the pressurized sea salt propels the salt onto the skin, and that way we exfoliate without sensitizing. I like that we use natural ingredients with this. Typically we see a lot of aluminum particles used for microdermabrasion, so this is just a safer, more natural alternative with less irritation and downtime.
So the other thing I didn't mention, I'm a cosmetic dermatologist, but I was trained by a very well-known medical dermatologist in New York, and one of the treatments that we did for psoriasis was send patients to the Dead Sea, right? So psoriasis improves with salt and elevation and light. Light and salt are both components of this device, so acne, eczema, psoriasis, rosacea, they all improve. That's the one thing about this device that's different than others, is you're gonna get improvement in patients that have sensitivity. If they're nervous about treatments, this is one of the treatments for them because they will get improvement without flares. And the patients that have psoriasis are very nervous about doing treatments on their face because they think the psoriasis is gonna capillarize or react on the face after treatment. It will not. Even with a peel, it will not if you do this treatment first. So if you have any questions, you can find me or Candace throughout the day, or see us later today at the SaltFacial booth, where I'll be answering questions and probably getting a treatment myself on Instagram and Facebook Live. Thanks, guys.
Thank you so much, Dr. Emer. Really appreciate it. Thanks for talking about the SaltFacial. I want one. I do.